Opioid treatment is a pressing issue that impacts countless lives, and understanding it is crucial for mental health professionals. This episode complements the opioid treatment course from therapy trainings, offering insights into the effects of opioids and strategies to support those facing addiction. Join us as we shed light on these critical topics, enhancing your perspective on addiction treatment. So, what can you expect to learn in this episode? We'll identify common prescription opioid drugs and their uses, discuss the risks and side effects associated with opioid use, explore the physical and behavioral signs of abuse and misuse, examine the nature of opioid addiction, and finally, we'll touch on the methods and consequences of prescription opioid diversion. By the end of our time together, you'll be equipped with valuable insights that can enhance your practice and help you support your clients more effectively. Let's kick things off by discussing the common prescription opioid drugs and their intended uses. Opioids are a class of medications that are primarily used to manage pain. Some of the most commonly prescribed opioids include oxycodone, hydrocodone, morphine, and fentanyl. These medications are often prescribed after surgeries, like for chronic pain management, or for severe injury recovery. But here's the catch. While these medications can be incredibly effective for pain relief, they come with a high potential for misuse and addiction. It's a bit of a double-edged sword. For example, oxycodone is often prescribed for moderate to severe pain, yet it can also lead to dependency if misused. Hydrocodone, another popular option, is frequently combined with acetaminophen to manage pain, but it too can pose serious risks. Now let's pivot to the risks and side effects associated with prescription opioid use. Understanding these risks is crucial for mental health professionals, as it allows us to better inform our clients and their families. Opioids can cause a range of side effects, including drowsiness, constipation, nausea, and confusion. In some cases, they can lead to respiratory depression, which can be fatal. It's vital to have open conversations with clients about these potential side effects. Have you ever had a client who was hesitant to discuss their medication because they weren't aware of the risks? By fostering an environment of trust, we can help them feel safe to share their experiences and concerns. Beyond these physical side effects, there are psychological implications as well. Many individuals may experience mood swings, anxiety, or even depression as a result of opioid use. As mental health professionals, we should be vigilant in recognizing these signs and addressing them appropriately. Now, let's delve into the signs of opioid abuse and misuse, which is a critical area to understand. It's not always easy to spot, as individuals may hide their struggles. However, some common signs can include changes in behavior, such as increased secrecy, social withdrawal, or dramatic mood swings. You might also notice physical signs, such as a decline in personal hygiene or changes in appearance. It's also worth mentioning that many people who misuse opioids may resort to borrowing or stealing medications from friends or family. This diversion can lead to serious consequences, not only for the person misusing the drugs, but also for those around them. So, how do we approach this sensitive subject with clients? We must be empathetic and non-judgmental. Encouraging an open dialogue where clients can express their feelings about their medication and any side effects they're experiencing is essential. A simple question like, "How have your medications been working for you?" can go a long way in opening the door for discussion. Next, we'll talk about the nature of opioid addiction itself. Opioid addiction is a complex condition that affects brain function and behavior. It often starts with a legit, innate prescription for pain management, but as tolerance builds, individuals may find themselves needing higher doses to achieve the same level of relief. This cycle can quickly spiral into addiction. When discussing opioid addiction, it's vital to emphasize the difference between physical dependence and addiction. Physical dependence means that the body has adapted to the presence of the drug, leading to withdrawal symptoms when it's not taken. Addiction, on the other hand, is characterized by compulsive drug-seeking behavior despite harmful consequences. Consider sharing a story or anecdote from your practice that illustrates this distinction. Perhaps you've worked with someone who initially started taking opioids for a legitimate medical reason, but found themselves unable to stop even when they wanted to. These stories can highlight the complexity of addiction and the need for compassionate care. Now that we've covered addiction, let's shift our focus to prescription opioid diversion. This refers to the illegal distribution of prescription drugs, whether through sharing, selling, or stealing. It's a significant issue that not only affects the individual, but also contributes to the broader opioid crisis we're facing today. Many people might not realize how common prescription opioid diversion is. According to the National Institute on Drug Abuse, a significant percentage of individuals who misuse prescription opioids obtain them from friends or relatives. This underlines the importance of educating clients and their families about safe storage and disposal of medications. As mental health professionals, we can play a pivotal role in this education. Have you ever found yourself explaining the importance of locking up medications or disposing of unused prescriptions properly? These conversations are not just about preventing misuse, they're also about empowering clients to take control of their health. Now let's address some common misconceptions surrounding opioid treatment. One prevalent myth is that addiction only happens to those who misuse drugs. In reality, anyone taking prescription opioids can develop a dependency regardless of their initial intent. This reinforces the need for careful monitoring and communication among healthcare providers, clients, and their families. Another misconception is that all individuals who are prescribed opioids will become addicted. While the risk is higher, especially when opioids are used over an extended period or in higher doses, not everyone will develop an addiction. It's crucial to approach each case individually and consider the person's history, mental health, and support systems. As we round out our discussion about opioid treatment, I want to leave you with some thought-provoking insights. The opioid crisis is not just a medical issue, it's a social and psychological one as well. As mental health professionals, we have a unique opportunity to address the underlying issues that often accompany addiction, such as trauma, anxiety, and depression. Additionally, we should advocate for a more holistic approach to pain management. This can include integrating alternative therapies, such as cognitive behavioral therapy, mindfulness, and physical therapy, into treatment plans. By doing so, we can help our clients find healthier ways to cope with pain and reduce their reliance on opioids. Finally, I encourage you to continue your education on this critical topic. Therapy Trainings offers a wealth of resources, including the course on opioid treatment we've discussed today. By visiting therapytrainings.com, you can access valuable courses that can enhance your knowledge and skills in this area. Thank you for tuning in today. I hope you found this episode informative and empowering. Remember, we all share a responsibility in addressing the opioid crisis and supporting those who are struggling with addiction. Together, we can make a difference in the lives of our clients and our communities. Until next time, take care of yourselves and each other.